Good afternoon. Joining me today is Dr. Tom SCALEA, who's the physician-in-chief of shock trauma at the University of Maryland Medical Center, and Chief Operating Officer of our Maryland Health Department, Dennis Schrader, Assistant Secretary for Public Health, Dr. Jinlene Chan from the Maryland Department of Health. Yesterday, I joined Vice President Pence, Dr. Anthony Fauci, Dr. Robert Redfield, and members of the White House Coronavirus Task Force for a meeting regarding the new surge of COVID-19, which is raging across the country, and to discuss the progress on Operation Warp Speed and vaccine developments. Yesterday, I also again urged the members of Maryland's congressional delegation to put partisan politics aside and to reach a compromise on the stimulus bill, which has been stuck in gridlock in Washington since April after falling apart at the last minute. This relief is desperately needed, more than ever before. This new surge of COVID-19 is going to continue placing enormous strain on both our healthcare systems and on our economy. Everyone on both sides of the aisle in Washington needs to come together to finally get this done for the American people. Earlier today, I also convened another meeting of our Maryland Coronavirus Task Force to discuss the COVID-19 crisis here in our state. Later today, I will be joining my colleagues from across the country for an emergency meeting of the National Governors Association. And on Thursday, I will be joining President-elect Biden and his team for a discussion on the coronavirus response. I've always been a straight shooter, so let me give it to you straight. The sad reality is that all across America, more people are getting infected with COVID-19, more are being hospitalized, more are going into intensive care, and more people are dying. While Maryland is still much better than most of the country, we are now seeing widespread community transmission in every corner of our state. We have now had 13 straight days with more than 1,000 new cases of COVID-19, and those numbers continue to rise. On Saturday, we added 2,321 new cases of the virus, which was by far the largest number of daily new cases that we have seen since the pandemic began this spring. Today, the Maryland Department of Health reported another 2,149 cases in just the past 24 hours. There were 149,000 cases across the U.S. yesterday, the 14th straight day that America passed 100,000 cases in a day. Maryland's 7-day positivity rate is now 6.85%, the 8th straight day that has been over 5%. 20 of our 24 jurisdictions currently have positivity rates which have now gone above that 5% benchmark. Maryland is in the red zone for the number of cases per 100,000, and our average case rate has risen to 29, which is a 46% increase in just the past week. Case rates have now risen above 10 in every single jurisdiction in our state, and above 20 in 18 of our 24 jurisdictions. I'll never forget back on March 19th, when it was my sad duty to report the very first coronavirus death in our state. This deadly virus has now taken the lives of 4,186 Marylanders. 26 Marylanders died yesterday. That's more than one dying every hour in Maryland. Now, I've heard people say, it's just the flu. No, it's not just the flu. We've lost more Marylanders to COVID-19 than we lose each year to car accidents, gun violence, and the flu combined. More than 247,000 Americans have already lost their lives to this deadly virus. That is more Americans than we lost in the Korean War, the Vietnam War, and the Gulf War combined. Today is the first time since June 7th that we have surpassed 1,000 COVID hospitalizations in Maryland. Hospital capacity in our state is up 100% since November 1st. 255 patients are currently in intensive care units, the highest level since June 19th. Yesterday, COVID-19 hospitalizations in the U.S. surged to their highest level ever, with over 73,000 Americans hospitalized. All across the country, this virus is spiking out of control at a rate much worse than it was in the spring. Even with the additional 6,000 beds that we provided for in our hospital surge plan, Maryland hospitals are now reaching capacity. All of this requires additional immediate actions to prevent the overburdening of our healthcare system and to stop more Marylanders from dying. We are very concerned that hospitals in Western Maryland, for example, are already at their capacity limit, and 19 hospitals across the state are above 90% capacity. Many of the state's hospitals have moved to status red to restrict visitation, and we have also activated the next level of our hospital surge plan in order to further protect doctors and nurses and healthcare workers. Today, the Maryland Department of Health is issuing an order which will restrict hospital visitation statewide until further notice, with the exceptions of compassionate care, parents or guardians of minors, obstetrics, and support for patients with disabilities. The Maryland Department of Health has also issued guidance to hospitals and other medical facilities at this critical time that they should, whenever possible, avoid any elective procedure admissions that are not urgent or life-saving if they are likely to require prolonged ventilation, ICU admissions, or may have a high probability of requiring post-hospital care in a nursing facility. We're also implementing a plan for hospitals to closely monitor the rapidly changing local and state situations and to take early, measured steps to prevent the need for additional actions. We do not want Marylanders to put off life-saving treatments or surgeries, but our highest priority right now is preserving capacity at our hospitals so that our doctors and nurses can do their jobs and make sure that people get the right critical life-saving treatment. To help us meet that goal, today the Maryland Department of Health is also issuing an emergency order allowing hospitals that are either full or near capacity limits to transfer patients to hospitals that are equipped and able to provide them with the care that they need. This will help alleviate the overcrowded hospitals in some areas of our state and place patients in hospitals where beds and medical staff are available and where they can receive adequate care. Today, we are taking further steps to ramp up our efforts to attack the most acute outbreaks, clusters, and hotspots, particularly when it comes to our most vulnerable populations. Until further notice, we are significantly limiting visitation at all Maryland nursing homes. Indoor visitation will generally be limited to compassionate care visits. All visitors will be required to have proof of a negative test result within 72 hours prior to their visit. I realize that this is very difficult, especially at this time of year, to be unable to see your grandparents or your loved ones. But please know that by refraining from visits at this time, you are helping keep them safe and to save the lives of our most vulnerable. Today, I've authorized a 100% increase in the number of rapid response teams which we can deploy to nursing homes and to other outbreaks, clusters, and hotspots. This will allow us to provide an extra level of triage and to quickly supplement critical staffing shortages. Today's Health Department order also institutes mandatory twice weekly testing for all staff at nursing homes, as well as mandatory weekly testing for all nursing home residents, effective no later than this Friday, November 20th. In addition, contact tracing data shows a large uptick in new cases among Marylanders who have recently been exposed in bars and restaurants. Today we're announcing that effective Friday, November 20th at 5:00 p.m., all bars and restaurants statewide and all facilities, venues, nightclubs, social clubs, and other establishments where food and alcohol are served will be required to close by 10:00 p.m. Takeout and delivery services are encouraged to continue, but in-person dine-in operations at bars and restaurants and entertainment venues will not be permitted between the hours of 10:00 p.m. and 6:00 a.m. This action was made in consultation with our Coronavirus Recovery Task Force and representatives of the industry, based on increasing reports that compliance with public health protocols drops dramatically later in the evening. I want to reiterate that since the existing statewide order was put in place on May 29th, bars and restaurants in Maryland have only been permitted to be open for seated, distanced service only, with strict capacity restrictions. No standing or crowding in bars is allowed at any time. Patrons must remain distanced at least 6 feet apart, and no groups larger than 6 people are permitted to be seated per table. Customers who are not seated cannot be served. This order carries the full force of the law, and it will be enforced. We have seen widespread failures to follow orders and public health advisories statewide. And again, we are calling on the counties to implement strict enforcement of all existing and new orders and directives to ensure that closures are not required. In the spring, we took statewide action to make it easier for restaurants to adapt their operations for carry-out and delivery services, including off-site alcohol sales and deliveries. We continue to strongly encourage Marylanders to support your local restaurants. We have provided federal and state assistance, financial assistance to these businesses, and we will continue to work with our local jurisdictions to ensure that they get this relief out immediately to restaurant owners and other businesses who are desperately in need of assistance. In addition, effective Friday at 5:00 p.m., the capacity for all retail businesses, organizations, religious institutions, establishments, and facilities statewide will revert back to the Stage 2 50% capacity restrictions. This also includes personal services businesses, bingo halls, bowling alleys, pool halls, roller and ice skating rinks, fitness centers, and social and fraternal clubs, with mandatory masking, distancing, and sanitation protocols required and enforced. In addition, fans will no longer be permitted at any collegiate or professional stadiums or racetracks. Maryland's statewide masking order remains in full force and effect. This existing order requires the wearing of masks or face coverings at any public indoor facility, including retail establishments, fitness centers, grocery stores, pharmacies, personal services establishments, and in the public spaces of all public and private businesses across the state, and when using public transportation. In addition, masks are required at all outdoor public areas whenever it is not possible to maintain physical distancing. This very simple step of wearing masks continues to be the single best mitigation strategy that we have to fight the virus. This is not a political issue. It's not a limitation on your right to infect other people, but it is the best way to keep you and your family members safe, to keep people out of the hospital, and to save lives. I want to remind Marylanders that we remain in a state of emergency and that all directives, executive orders, and public health advisories remain in full force and effect. Violation of the public health emergency orders is a crime, a misdemeanor, subject to a fine of up to $5,000 and up to 1 year in prison. In addition to masks, avoiding crowds, and social distancing, one of the most important things you can do to protect your friends and family is to get tested for COVID-19. If you are a college student planning on returning home, get a test. If you are planning to spend any time around your grandparents, get a test. If you are returning from any out-of-state travel, get a test. We have more than 220 sites available all across the state. You can find one near you by going to covidtest.maryland.gov. Last Thursday, I said that my family was canceling our Thanksgiving dinner. Since then, I've heard from hundreds of people who have said that they have decided to cancel their plans to celebrate with family and friends this year. More important than any public health order is our willingness to take personal responsibility for our own actions and to make the necessary sacrifices to limit our interactions, even sometimes with our own family members, in order to protect ourselves and one another, especially the most vulnerable. This virus has been with us for so long that too many of us have become numb to the staggering, spiking numbers that are being announced every day. It does not matter how well we have done for all these months. If we falter now, and if we fail to take this seriously, we will look just like all those other states. And this deadly virus will strengthen its grip on our state and our nation. Regardless of all the disinformation that's being spread all over social media, this is not the flu. It's not fake news. It's not going to magically disappear just because we're all tired of it and we want our normal lives back. We are in a war right now, and the virus is winning. Now, more than ever, I'm pleading with the people of our state to stand together a while longer to help us battle this surging virus. Your family and friends are counting on you. Your neighbors are counting on you, and your fellow Marylanders are counting on you to stay Maryland strong. Now at this time, I'd like to turn it over to Dr. Thomas SCALEA, who is going to discuss our hospital capacity planning and the surge management order that we talked about today. Thank you. Doctor?
Thank you, Mr. Governor. I ran out of the operating room. I didn't have time to change. I apologize for doing this in scrubs.
You look very official that way.
Yeah, very. For almost 50 years, Maryland's been the role model for the nation for organized trauma care. It's based on the principle of delivering the right patient to the right place in the right amount of time. Centers with special expertise have been designated to provide the most sophisticated care. Most importantly, all Marylanders have equal access. The COVID-19 pandemic has taught healthcare practitioners many lessons. Perhaps the most germane for this particular discussion is that people who develop the need for critical care decompensate quickly. Standard ICU care may be fine for some, but not for all. During the first surge, the University of Maryland piloted a program that involved creating a central access point for critical care beds. Patients then got distributed across the medical system, all 14 hospitals, in a way that served the patients best. In particular, the downtown medical center didn't take care of every sick person, thus preserving our beds for the sickest of the sick, particularly those that needed heart-lung bypass to treat their lung failure. This was an unqualified success. We have proof of concept that a system like this would work. The governor and the state has created really a statewide plan to distribute critically ill patients across all hospitals. This program is both wise and timely. MIMS, the Maryland Institute for Emergency Medical Service System, is the ideal place to house this innovative program. Trauma is the quintessential time-sensitive disease, but it's not the only one. Bad COVID is another. Organizing time-sensitive care is what MIMS does best. As with trauma care, no one medical center or medical system should own this. It should be a state resource open to all Marylanders. The physicians staffing this will have visibility for all ICU beds throughout the state, and more importantly, will know the capability of each of the individual intensive care units. Currently, individual hospitals need to go critical care bed shopping. That usually takes place within their own medical system, ignoring available beds that may exist actually relatively close to them. Now, a single phone call will give them access to the appropriate level of critical care services. This is, of course, based on a principle that everybody's going to cooperate and play ball. I'm sure that will be the case. The governor and the state of Maryland have stepped out in front of the second surge. This program will give immediate access to the most appropriate level for critically ill Marylanders. This may be transferring people with COVID to another hospital, but it may be having a patient in your emergency department that's COVID positive that's appropriate to stay there, and then transferring a COVID negative patient to a different hospital to make room for the COVID positive patient. It's a very dynamic program, and it's built on solid triage and disaster management principles. I'm certain that it'll improve ICU bed flow, as we anticipate, as the governor has just told us, a large number of critically ill patients. We pray for the best, but we plan for the worst. Frankly, this program, not if, but when successful, will be an example for municipalities throughout the United States. Once again, Maryland will lead the way. This is about getting the right patient to the right place in the right amount of time to receive the correct level of medical care. It's exactly what all of us in healthcare train to do, and I speak for my entire profession when I say we stand ready for whatever lies in the future. Thank you, Mr. Governor, for the opportunity.
Thank you, Doc. With that, we'd be happy to take a few questions.
Hogan, skeptics might say the virus isn't any different at 10:01 p.m. than at 9:59. Can you please elaborate on why the need to do that?
Well, as I said, it was based on the best public health advice from some of the smartest doctors and scientists in the world, and in consultation, our Department of Commerce with folks in the industry, that people are just less likely to follow public health advice after 10 o'clock after drinking for a long time in a bar.
So, Pam's asking about going farther with restrictions. How are you deciding how far to go now? I mean, some people are saying, let's go all the way right now. How are you balancing keeping things open versus moving forward?
It's a very difficult decision, and we try to balance the health needs, which are critical, keeping people alive and keeping our hospitals from being overflowed, with being worried about people's livelihoods and losing their jobs and their small businesses. And, we just listen to all the best advice from everybody we can think of to ask, and then we make the best decisions, just like we did for the past 9 months. We may not always get it right. Some people may think we're going too slow or too fast, but we're making the decisions every single day that we believe are in the best interests of the people of Maryland.
Governor, a minute ago, you seemed to be quoting the President of the United States when you said this is not fake news. it is not going to magically go away. Governor, can you tell us what you are going to discuss with the President-elect on Thursday, and how the current situation with the election standoff is adversely affecting the COVID response, not only in Maryland, but throughout the country?
Well, so I had a couple of great conversations with the Vice President yesterday. The White House coronavirus team is still working hard every single day. They're making great progress on Operation Warp Speed and the vaccine. This will be my first opportunity to talk with the President-elect. I talked about that yesterday with the current administration. I'm very concerned that we're in the middle of this battle with people dying and hospitals overflowing in every state in the country. And we have to make sure that there's a smooth handoff. I'm hopeful that we will, and I think it's getting better. But we have a brand new team that has not been involved, that doesn't really know much about what's currently happening, and that's a problem. So the good news is we're having meetings with both, and the Governors Association is having a meeting today for all of us 50 governors to talk about what we want from both the outgoing administration and the incoming administration and what we need. So I think we're having productive dialogue, which is the first step.
Governor, back in, we're not seeing numbers that we were seeing in late May and early June.
We're seeing in some cases worse, that we had our biggest day ever.
To my point then, at the time, that was when you were seeing case numbers come down, but the state was in a very different situation. We were starting to get to the point of easing restrictions, but still in late phase one, sometime in some places phase two. Are we moving away from the use of phases, and is that driven in any way by more reliance on contact tracing?
You know, we know a lot more about the virus. We know a lot more about how to keep people, more people out of ICU and to keep more people alive. You know, don't forget, back in February and March when we were first beginning this, nobody knew anything about it. And we had no testing. We were able to do 50 tests a day. Now we do 30,000. We had no 6,000 extra hospital bed capacity. We didn't have any therapeutics. We just had people dying and stacking up in ice rinks because we didn't have more capacity. So while the numbers of cases is alarming, we're in a, the battle's not getting any easier, but we have more weapons and we have more soldiers on the field, and we're in a better position to fight back. And so, what we thought was the best advice in March or April or June or July or August and September is different from the advice we're getting today based on all of those changing things. And we don't want to use kind of an old metric to deal with today's battle.
As far as the surge capacity is concerned, when it comes to the convention center in Baltimore and in Laurel, from what we gather, there haven't been a lot of patients, at least at the convention center. What is the plan, and is there an advanced plan to put more people, to make more surge capacity if you need it?
Well, our goal all along and our plan was to not fill up those additional surge capacities, but to have them there. And Dr. SCALEA said, we pray for the best, but prepare for the worst. And that's sort of what we did with the surge capacity. We reopened the Laurel Hospital. We built the Baltimore Convention Center into a surge hospital to be prepared in case it was necessary. Our goal is not to fill them up with people, but they are currently still available and ready to handle that. And it's certainly looking more likely that we may need to.
Can you talk a little bit about testing and the capacity for testing right now and the time it's taking to get some results back? I've heard that we're seeing some delays in getting the results back like we were seeing in the first surge. What's the state planning on doing to address that?
Well, the state has no delays whatsoever in testing. There is a big demand for testing. We're now doing 30,000 a day. I just did a 15-minute test. It took 15 minutes. That's available all across the state. Our normal point of care testing, I think we're turning around in 24 hours. There are private firms in other states where, different contractors are sending out to a state, for example, I don't know where they're headquartered. We can't control how fast or what their load is. When you have 60% positivity in South Dakota and you got, 40 states that are in much worse shape than us, I'm not sure how they're prioritizing which tests get done first. But no, we can't really do much about whether it takes a week for some private lab to get us back a test, which is why we're encouraging people to utilize, for screening purposes, the rapid tests, where you get instant results for most people, and or to use one of the tests that we can get back faster. Tom? Oh, sorry, then Brad. You guys always raise your hand at the same time.
Some of your most eye-opening rates right now are coming in rural counties.
Yes.
What can you attribute that to, and has there been any special effort to get the word out to regions that are not near Baltimore or not near Laurel, because those are quite geographically separated areas?
It's a really good question. In the early fight against this virus, the first wave, and the second kind of wavelet that we had in June or July, it was really more of our population centers, not just our urban areas, but our suburban areas. And it was in the Baltimore-Washington corridor. We had very little issue on the Eastern Shore, Western Maryland. And now we're seeing problems everywhere, but our absolute worst are in those rural areas, particularly in Allegheny and Garrett County, but in other places on the shore as well. And so, you know, I think certain people out there had a false sense of security that, oh, that's, you know, it's very concerning, but I don't have to worry about that because I live out here in this rural neighborhood, and they maybe weren't being as careful and not paying as much attention and maybe not wearing masks and not following advice. And now they're calling us begging for help, and we're sending strike teams, and we're trying to move patients out of their overflowing hospitals, and we're talking with the local leaders. So it has changed. It just shows it doesn't matter where you live or what, you know, demographic group you happen to fall into. This virus doesn't care. It doesn't recognize county borders or state borders. It's coming for all of us, and we've all got to be as vigilant as possible to stop it.
I actually wanted to ask about this. You know, over the last several days, weeks, we've talked to healthcare providers to say, you know, yeah, we have capacity, we know more now. Is there any reassurance that, you know, how much more do the hospitals, how much more do your care providers know about this disease now? What can you tell people
Well,
about?
maybe I can have, you want to take that one? I'm going to turn that to the experts.
Yeah. How much better are you now at treating this?
We're a ton better. You know, I've been doing this a long time, and I don't remember learning this much about a single disease over such a short period of time. And I think back to when we took care of our first person with bad respiratory failure and the way we care for people now, and it's completely different. That doesn't mean that everybody lives, though. It means we're a lot better. We've got a bunch more weapons. We understand how to use them, but they're not universally successful. We'd be really happy to do it less often. That answer?
Yes, there come a time where if these numbers continue to surge to the extent they have, that we lose the ability to contact trace? I mean, can it overwhelm the speed with which it's coming and the numbers to the point where we can't keep up with that?
Well, it's a good question. You know, we've been ramping up for quite a while. I think we have 1,400, you know, contact tracers. Our problem right now, I don't believe, is capacity of the contact tracers. Our problem is that so many people refuse to give the information. And so it's like half the people somewhere? A little more than half. We contact them. They don't want to participate. And so, you know, this is not Big Brother. We're not trying to, you know, track you. We're trying to stop the virus and stop you from infecting people that you come in contact with. And it works very effectively, but we just have to get the word out for people to participate. We did launch our COVID tracking app just a week or so ago. We've already had 1 million people, 1 million in a week, go on to utilize that app. So some people are really concerned and want to help protect themselves, but there are an awful lot of people saying, I'm not doing that, and that's really the issue.
Governor, if you mentioned how this is a war, that the virus right now is winning, if things keep going the way that they have been in recent week or so, when will, like the convention center, the field hospital, when will we have to have some spillover into something like that?
Well, again, our goal is to not have to utilize the spillover, but it's why we instituted all the things that we're talking about today. We had a long talk with the leaders of every single hospital system in the state earlier today to talk about all of the collective ideas for keeping that from happening. But they're there in case we need them. That's why we built them in the first place. And we don't really know the answer. I mean, we do modeling and we look at the rising numbers and we see what's happening in 40 some other states. It's pretty scary. And you know, if we are not able to get it under control, we're going to look like those states. And I don't know if you see some of that stuff on the national news, but there are states with turning away patients and people stacked up in hallways and no ability to treat them.
Governor, do you anticipate that there'll be a need, given the increase in cases, that there'll be a need to reopen some of the testing facilities at the vehicle emissions, the state vehicle emissions places that were?
Well, we just transfer them to different locations. So we have more testing facilities than ever. We have 220. We're doing more testing than ever. We do, I think, 30,000 tests a day, which is, really strong. We just found that those locations didn't work as well as some of the others that we've opened up now. But if we need to think about that, we certainly will.
You said earlier you got a rapid test today. Is that part of normal protocol now for you, or?
Once a week, all of our staff here and all the government workers in Annapolis, we have once a week in Baltimore, once a week here. Anybody who wants a test can get a test. We'll even let you guys come get one. Yeah. Thank you all very much.
Thank you.